wish Sister Catherine would open up her eyes and listen to what we are trying to do. We are not doing it for wages. We are doing it for the patients, for the hospital, and for the nurses.
I'm very proud of the hospital that we work in. I just want to make it better.
You know, it's been a long struggle here at Santa Rosa Memorial for employees just to form their union, and I believe it's a good thing to have a union, and I just want to say that we want to keep fighting and be strong.
And we do need to have a union there, and a message to the sisters. It's like, you know, this is not a bad thing. You know, they've helped in organizing unions for other places, so they know directly that this is not a bad thing, that this is a good thing. And so why are they doing exactly what they fought years ago, and now they're doing it against us when we used to work together and to making sure that places were unified?
My thing is if you respect us, then why are you unwilling to be accountable by sitting down with us and having a fair election agreement, hashing this out, and having an arbitrator that will decide relatively immediately if there are any infractions of the rules. Of course, this would be mutually negotiated. Why are the sisters so fearful of this? Why are they so fearful of their own employees?
My name is Rosa Santos. I work in OR for 8 years in Santa Rosa Memorial Hospital. I am a surgical tech, and I pass the instruments during surgeries, and I assist the surgeons.
And I prep food, and I work tray line, and I make milkshakes.
I'm an anesthesia technician.
I'm an LVN. I work on a telemetry unit.
We clean instruments and we put them up for the next day's surgery.
It ranges from physical therapy, speech therapy, and occupational therapy.
I draw blood. I specialize in children, autistic children, babies.
Hi, I'm Jack Nicholson, from Santa Rosa Memorial Hospital. I work in imaging as a radiology tech.
You break it, we'll take a picture of it.
Soy float. Quiere decir que yo trabajo en todos los departamentos, a donde me necesiten, yo voy y trabajo.
My job is very involved throughout the hospital. I work in the ICU with ventilator patients.
I do assist the nurses and the physicians in cesareans,
Post-op heart patients.
deliveries.
I work with trauma patients.
Sacar el INE en todo el hospital.
Treadmills and EEGs.
Run the level 1 rapid infuser.
Sacar basura.
Transcription.
Assist putting in central lines.
Limpiar el área de allá afuera.
An EKG tech.
Help them feel better.
I have been there since the hospital opened up.
And I've been an employee there for 27 years.
For 17 years.
For the last 12 years.
6 years.
For 19 years.
9 years.
6 years now.
8 años.
Since 1985.
34 years as a respiratory therapist. I've been at Santa Rosa Memorial for 22 years.
5 years in the nutrition services department. Yeah, I feel pretty good and proud about what I do, and I'm really passionate about forming a union.
When I first started working for Memorial Hospital, I used to watch the sisters throughout the hospital. They would come in and out. You would have direct contact with them. It seemed more appropriate then because you knew that the sisters took the patient's care into effect. But now you don't see that. All you see is everybody trying to save money in whatever capacity they can.
Like the lift team being laid off, I think that's really a difficult thing for all the nurses. All the nurses I've heard on the bus in the morning when I go to work, how difficult it is and how hard it is not having them there to help them when they have a patient that needs help getting up and down and, trying to find somebody to help them because they're all overwhelmed up on the floors.
I'm one anesthesia tech. I have 10 rooms to cover, plus the EP lab, endo, OB, and it's way too much for one person to handle. And talking to administration, my supervisors asking for help, they keep telling me there's no money in the budget for a second anesthesia tech.
I've had the directors, or not the directors, but supervisors and managers tell me not to be using needles that are small. No, use the bigger ones. They cost less. You know, do you know that that's going to hurt this little child? Their focus isn't really on the patient care right now, and I don't see it at all.
They're asking me to take my standard of care from this level to this level. And I just can't stand that because I'm spread so thin. I'm stuck in one emergency situation where there's another one going on and I can't get to it.
I would like to have a voice, and I would like to have better staffing, and I would like for patient services to not be erased from the system because of cost.
One thing that I'd like to see is more consistent benefits for part-time employees.
Es muy importante para mí que estar seguro de que yo voy a tener mi aseguranza va a continuar.
Health insurance is very important, and we spend our careers providing health care, and I feel that we should at least have some sort of health care upon retirement.
I really want to grow in my department, grow myself. And I think we have a lot of things to share with them.
We can give ideas about how we can make our OR better, how we can improve our patient safety.
Been times where they've asked for input and we've given input and there's not been response to our input. So I would like to see us raised to a next level where our creativity could be utilized.
To have the workers' voices being heard.
Having a real voice is my main thing, because we know we're the ones being affected and we're the ones doing the work.
It's an individual choice whether any of us wants a union. It's up to us individually. But in order to make that decision, we have to have the information, unbiased information with no fear. And that does not exist right now.
I've noticed in the past 4 years that we've been trying to organize at Santa Rosa here, that there is a climate of fear that I've noticed in a lot of my coworkers. But it's just the feeling of they have no protection. They can be arbitrarily singled out.
Right now I feel that we do not have no protection against job loss or maybe even getting laid off.
I think having a union would help in our staffing ratio, which is my main concern. Right now in my unit, I think at times it's unsafe. And if we had a patient safety committee through the union on our contract, I feel that we have more say in how the staffing ratios would go.
For instance, if we had a union, we would have sat down with management and discussed the best way we could avoid the massive layoffs.
So by having a union, it would secure my job and it would secure my family's benefits.
The reason why I want a union is, basically to have a voice.
Please consider your employees and everyone, not just the people that are for the union, their right to an environment that fosters a fair election. Thank you.
If there is a higher power out there, we need the help. We need the help to improve this hospital, to improve this county. And not only me, but many behind me.
Because of the worker justice that this brings in forming a union and organizing our hospital. And I gained a passion towards that, and it just gives us more of a unity and respect, dignity to all of us.
And with workers feeling better about what they do and that they have somewhat of a control over some decisions, and that's a tremendous morale builder, and people have a lot more loyalty to the organization when that happens.
And the NLRB process is not adequate, is extremely inadequate in supporting that environment. And I'd like to say that we really need that fair and free election so that we can have a democratic process.
Let us to build with our union, and don't give us intimidation, and especially stop the giving intimidation to us. Let us to build with our union, because I know we can make a better place to work. And that's it.